South Africa's confirmed coronavirus cases stands at 1,749. 13 deaths have been reported so far. Now, it seems the number of infections are not rising as quickly as they are in many other countries. Does this mean the national lockdown is working? For more on this, I'm joined by Alex Van Den Heever from the Wits School of Governance. Very good morning to you, Alex. What does it suggest? That the lockdown is working?
The numbers seen on their own do suggest that the lockdown is working and that it was introduced at the right time. I think one does have to be a bit wary of the fact that we could potentially have two different kinds of epidemics in South Africa. One which is largely the affluent community who introduced the disease to South Africa through international travel, and then the rest of society where a generalized infection might run rife. The testing regime has, however, tended to focus on that relatively affluent group because of the way the testing criteria was structured. So it is definitely picking up that the lockdown is working in the affluent communities, but the question is there an undetected epidemic in the rest of society? And that's really where the emphasis now has to lie in terms of testing.
So are you saying the level of testing is not enough, that we have yet to roll it out successfully so that everybody has access to it? There are different types of testing regime. At this point in time, they were expressly excluding testing certain parts of the population. In other words, people presenting with symptoms but didn't have any connection to a traveller or somebody who tested positive. And so somebody who had COVID who presented would have been sent home. Now, that means that even we would have detected maybe a few cases, not all the cases, but we would have already been suspicious of the fact that there might be a community-based outbreak that we're not detecting. So, yes, we need the mass testing to expand. We also need the testing regime to go into communities that are not associated with the travellers. So, off the back of what you are saying, then lifting a lockdown after 21 days would be premature?
On the other, one thing to consider is whether the lockdown is a successful prevention method for everybody in South African society, and it may not be. So that's also one of the reasons to test properly. I think that the lockdown has potentially been successful if we've got confirmation that we don't have other undetected community-based outbreaks. I think that we should be moving toward a more efficient or a more effective, more sustainable health prevention strategy, which is mass testing and rapid contact tracing as our key strategy going forward, because the lockdowns themselves are actually economically very damaging, whereas mass testing and contact tracing is a very effective method of preventing the disease that is less economically damaging.
Okay, so if no lockdown, then other than mass testing, how do we get that balance of making sure that the economy keeps churning, that the poor are not badly affected, and that everybody's safe?
I think the balance comes with the right prevention strategy. A lockdown strategy is a very crude one. And usually it's implemented where you've lost control of the epidemic, which in South Africa we haven't, but we could have. So it's quite possible that we've caught it in time. We introduced the lockdown at a much earlier stage than many countries have done in the Northern Hemisphere. And that, I think, has potentially bought us some time. But the question is, what did we buy that time for? It can't be to implement another lockdown. It has to be to buy the time for mass testing and contact tracing. And we potentially have the ability to scale up, but that has to be our replacement strategy for the lockdown. From an economic perspective, we lost 500 billion rand with this lockdown in GDP. Every lockdown is going to cost us that. There's just no way. We run out of runway on everything if we continue with one kind of health prevention strategy. The mass testing and contact tracing has been more successful than lockdowns in the countries that have done it and introduced it at the right time.
And obviously, I mean, we're seeing attacks on schools, looting of schools. A big fear, obviously, any type of social unrest.
So the consequences of a major deterioration in the economy and society at large will have huge health effects of its own.
and permanent effects. So we've got to be very careful now at the balance between preserving the integrity of society and the health strategy that we use. So I think we've bought time. I think the lockdown was definitely the right strategy at this time, given that we couldn't scale up testing initially. But now we have to move into a different regime. We will have to prevent a resurgence. If this was contained during this period, we would have to prevent a resurgence from happening into June. But we have to be ready for a completely different approach and a more sophisticated approach. But I think it's one that South Africa is capable of introducing, unlike quite a few other countries in Africa probably. But in South Africa, we probably can.
Thanks for sharing your expertise, Alex Van Den Heever.